So I'm just going to start by introducing myself. So I'm Rafael Bartesha. I'm a consultant at C-Space, and today I'm going to talk to you about reimagining health research for the LGBTQIA+ community. So I'm personally interested in amplifying the voices of underrepresented consumers, specifically BME and LGBTQIA+ consumers, and how to kind of tell that intersections, represent that intersection in insights and storytelling. So the idea for this presentation actually arose from some internal discussions we were having at C-Space, both with our UK and our US offices that work with kind of health, pharma, and wellness clients. And as we strive to be more inclusive at C-Space, we are kind of thinking about how we can model that behavior ourselves and make sure that our health research is more inclusive to LGBTQIA+ respondents. Is this working?
Yes.
There you go. So as we know, access to healthcare remains a struggle for LGBTQIA+ people, specifically for trans, non-binary, and intersex people. So really harrowing statistics from Stonewall show that 70% of trans people report experiencing transphobia when accessing health services. But that's not all. LGBT people still face hurdles today. So 25% report that they feel that there's a lack of understanding of specific gay, lesbian, and bi needs in the healthcare system. So in this context, interest in DI is growing in the health industry, as it is everywhere else. But how can we really make sure that we are including LGBTQIA+ perspectives in the right way? How can we make sure that this is not just a box-ticking exercise? So this is a question that my colleague, Ella Majava, who's the Director of Innovation at C-Space and a DI expert, set out to understand, and myself, obviously, presenting to you today. So we did this in a number of ways. We had a survey on our Consumer Now community. We also launched a survey to 200 respondents identifying as LGBTQIA+ on their experiences with health research in the US and in the UK. And we conducted some expert interviews with senior market researchers and recruiters specializing in health and pharma. And what we found out is that we simply need to reimagine the health research experience entirely. And we thought of 3 ways to do this. Okay. So the first one is to create an inviting space for everyone that the category serves. Why might you do that? Because 66% of LGBTQIA+ people we surveyed report that they feel that the questions they're asked are not applicable, inclusive, or relevant to them. 66%. Nearly more than 2/3, that's a huge number. How might we go about reducing that number even a little bit? So the first one would be to prioritize own voices moderators. This was actually the top way that LGBT people reported would make them feel more comfortable participating in health research. They feel that this is quite an intimate topic, and having someone from the same community actually makes them feel like they're in conversation rather than being interrogated. Another one that's also easily implementable is to implement inclusive screening practices. And there's a myriad of ways you can do this. The first one would be to use multi-choice. Most people are not one thing. They're many things at once. And if you give them the space to tell you, they might actually reveal more about themselves that might be important to your research. The second one would be to leave an open-end box. So I have a quote here that I can't see about a participant who put that beautifully. So researchers should include a type box for you to include your pronouns or self-identify your gender, as it's near impossible to include all the identities. So a respondent put it best: you might not actually know how people refer to themselves, so give them the space to do so. And the last one is to never use an other box, which is, well, otherizing. So I actually have an example for this from a C-Space colleague in the US who has a community about menstrual pain. And she started implementing a profile field where people could self-insert their own pronouns. And even though most of the respondents did use she, her pronouns, for the few that didn't, it really went a long way to making the community more inclusive and was actually really helpful for moderators to know as well. Lastly, don't forget about project names and also the look and feel of your communities. So words aren't the only way you might exclude someone. So let's think about if you have a community thinking about menstrual products, having it all decked out in pink and flowers, things that are stereotypically feminine, might send a message about whose perspective you're really trying to include and whose opinion you want to hear. So we want to avoid things like that. The second thing would be to adopt a person-first approach. So as researchers, we pride ourselves on being curious, but actually, too often, when we talk to LGBTQIA+ people, we realize that they feel that we are making a lot of assumptions about who they are. How can you avoid that or minimize that, as we all have assumptions? The first one, an obvious one, would be to ask, not assume. And one way to do this is to actually mirror the language that the person you're talking to uses. So for example, if you're talking to a couple, a lesbian couple trying to conceive via IVF, listen out for the ways they talk about the donor. Some people might talk about it as a parent, and some people might talk about it as a donor, and it's very important that you listen out for that and mirror what they're saying, or at least ask if you're not sure. Another thing would be to do that regularly. If you see people often, it's not a guarantee that the way they liked it last time is the way they like it now. So think about that when you're interrogating them. The next one would be to acknowledge the entirety of a person's experience. We might think that when we're talking to LGBTQ+ people, that putting their experience at the forefront is doing them a favor or being inclusive. But actually, it can feel quite dehumanizing. Like, for example, with this quote here, where the research should ask questions that pertain to me, not to the group that you perceive me as. So the reason for that is that actually, a person's circumstances are very diverse, and this is even truer for healthcare. So for example, beyond their queer identity, there might be many things that affect their access to healthcare, their race, their personal condition, their income. And there is no saying that their queer identity will be at the center of that. So give them the space to explain to you who they are. For example, we can think about Black people who might feel that their race impacts the way they access reproductive healthcare more so than their gender. So it's important to really consider the person fully beyond just the thing that you're kind of reaching out for them for. And finally, embrace nuance. So obviously, LGBTQIA+, lots of letter, math is just an umbrella term. There's a bunch of identities that are covered under that, namely sexuality and gender, which are quite different experiences. Think about whether it makes sense to report these things kind of as a monolith underneath a same term. It might not, even if it's the same term. For example, trans people might be considered as one category, but if you're reporting on them, trans women, trans men have vastly different experiences when talking about reproductive health or many other things. And actually, even though you might be dealing with small sample sizes, which is actually often the case when you're dealing with LGBTQIA+ respondents, it's still important to keep that nuance in mind, because it will be not only more respectful to the people you're engaging with, but also it will make your insights richer. It will tell more stories. We talked a lot about storytelling today. Think about the impact of telling the story of one person can actually have on a client, even if you're interrogating 300. Next, it would be to rethink roles. I really want to encourage you to champion the consumer as the expert. And why do I say this? It's because actually LGBTQIA+ people don't feel represented by brands' language, by brands' imagery, by brands at all. So for example, I have a person here who says, it feels like LGBT people are not seen, we're invisible. What can we do to make LGBT people feel more seen? What I recommend is co-creation. So bring brands and consumers together to actually workshop together what the solutions of the future are, and then LGBTQIA+ people will feel more involved, more part of the process. Another thing is to consider doing that actually along the whole of the product journey. So oftentimes LGBTQIA+ people feel that they're presented with a product or a campaign at the end of its journey, and they're kind of just asked only to say, does this work with LGBT people or does it not? this can feel quite tokenistic. So creating spaces where you can actually regularly interact with consumers and ask them about their opinion will make sure to embed inclusivity of LGBTQIA+ people in your work all along. So, to conclude, if you had to remember only one thing, I mean, really, only 3 things about reimagining the health research experience, but also any kind of research experience for the LGBTQIA+ community, would be to be more inclusive, more curious, and more collaborative. And now I ask you, what can you do tomorrow to make that happen in your research? Thank you.
Raphael, that was brilliant. That was absolutely fantastic. You are so clear on the tangible actions everyone can take. Like, this isn't a lovely theoretical, what do we do? This is really specific and a rallying cry, so thank you. Are there any questions in the room? Fabulous.
That was amazing. I've been one of those people who has had to have quite an awkward conversation with the GP to convince her that my wife and I have been trying to have a baby naturally, which was interesting. So yeah, very needed and really inspiring. I wanted to ask about intersectionality. So you mentioned it a little bit. Were you able to dig into that with the kind of sample sizes that you have?
So, sorry, excuse me. Thank you for the question. Obviously, an issue very dear to my heart as well. I think, unfortunately, it was not something we were completely able to dig out. If I could do the project again, and if I had unlimited money, I would do endless IDIs on this topic to kind of really get into that. But I do think it's true that it's, you know, a big factor. I mentioned race, there's other things. I think income, and also you know, at C-Space we work with very many different markets. The situation for LGBT people is not the same everywhere else, and obviously we'd have to adapt if we were asking that question in other markets as well.
Really great, thank you.
Hi, I'm Brian. I identify as the G in the very long acronym that seems to keep growing. Great presentation, thank you so much. One of the, I suppose, questions we've had kind of at Humanate where I work is, you know, thinking through it as a kind of gay person, does kind of focusing on inclusion actually mean kind of elevating to the point of exclusion? And actually should we be looking more about kind of expansive approaches where no one kind of group is put above the other and you design almost through a human way rather than based on someone's sexuality or based on someone's gender? It's a bit of a philosophical question, I suppose, but yeah, just I don't know, I suppose for you, is there any challenges you foresee with kind of, you know, elevating maybe a different way of approaching how you speak with LGBT plus?
Yeah. So I think kind of my idea behind adopting a person first was kind of touching on that, because I think obviously we need, you know, we get so keen with the idea of like, we're going to solve this problem that we're going to really dig in. But really, you're right. I think that if we did approach people with kind of grace and openness and all of that, this would not be an issue, and these topics would come naturally. But I think we need to have a first stage where people are trained to be more open, because currently, even if we don't realize it, when we don't actually make an effort to include people, we are being exclusionary because we're just not at a level where a regular survey that's not been looked from at a DEI angle is inclusive. But I think you're right that once we get to that point, and hopefully within the next 10 years, then we can move and be more expansive to like truly just look at it from a human eye.
Thank you.
I think those are great points, although I really hope it's sooner than 10 years, I have to say. I think we have time just for one more question. Lovely.
I guess a bit less of a question, but just a reflection to say I've really seen some of what you said in sort of the 3D real-life medical world as well. Like, only last week, like at our doctors, you can check in now yourself. Don't know why it doesn't ask you for your name. Instead, it asks you for your gender and your date of birth. And the very first question you're asked is, which gender do you identify as? And you've just got male or female. And I think if the first thing you get in a doctor's is that, then feeling like, have you got open than that in the actual, you know, when I go in and see my GP, it doesn't really set the right tone, does it? And I guess thinking about it in a research context, like you said, for communities, being really conscious in things like screening surveys and stuff like that. If you want the right people in, you need to be awareness of it straight away. And like Bri said, it's not necessarily, I mean, we do have projects about certain different in the world and in the community, but making sure that we're never putting people off straight away so that we can get those voices when and where we need them.
I mean, I agree, it's a great point. And I also think it's something I didn't mention here, but actually one of the things that LGBT people wanted the most when it came to health research, and that would make them feel more comfortable, is actually knowing why you want that information. I think if you're, doing market research, it could kind of feel like you're in a zoo, like that's what a lot of quotes were going about. Like, I don't want to feel observed. I feel like I want to have a conversation. And I think obviously gender identity in the medical sense is especially difficult because there are still probably times where you do need to know the gender of someone is assigned at birth, and this is a big question about how you actually get that question, because obviously most people don't want to reveal that. So there's a bunch of different methods we could think about to get that, like for example reaching to advocacy groups, things like that, to find people who are already willing to talk to you about that stuff rather than kind of asking invasive questions. But I agree, I think we should probably be mindful about the way, if we are being truly inclusive by asking that many questions, to kind of feed our data tables.
Amazing. Raphael, thank you so much. That was absolutely fantastic.